Hello, students, and welcome to week 4, where I will discuss conflict resolution and effective communication in healthcare. I am your instructor, Dr. Bensley Brooks. Just to give a brief bio of myself, I hold an Associate of Science in Mortuary Science from Gupton Jones College of Funeral Services, Bachelor of Science in Health Sciences, and Master of Public Administration with a concentration in healthcare from Liberty University, and Doctor of Healthcare Administration from Virginia University of Lynchburg. Let's get started. By the end of this week's course, you will be able to critically analyze and apply advanced strategies for conflict resolution and effective communication within diverse healthcare settings. You will demonstrate the ability to assess interpersonal and organizational conflicts, employ evidence based communication frameworks, and facilitate collaborative problem solving among interdisciplinary teams to improve patient outcomes and teams dynamics. In healthcare, conflict can arise from a variety of sources, and it's important to distinguish the types so we can tailor our resolution strategies accordingly. First, interpersonal conflict is probably the most common. This could be a personality clash or miscommunication between two staff members. Interprofessional conflict takes that a step further, involving entire professional groups. This might happen, for example, when nursing staff feel their insights are undervalued during rounds. Then there's organizational conflicts, which stems from a much more broader structure, things like inefficient workflows or unclear protocols. Intrapersonal conflict is more internal. It can be especially stressful when your professional responsibilities can clash with your personal ethics. Lastly, patient provider conflict occurs when patients or families disagree with the care team, often rooted in communication breakdowns or cultural differences. Recognizing these categories helps us better understand the root cause and approach each situation more strategically. Recognizing these categories helps us better understand these causes and helps us be more efficiently in fixing them. In this week's reading, Conflict Management in Nursing, Analyzing Styles, Strategies, and Influencing Factors, a Systems Review, it explores the prevalence and nature of conflicts among healthcare professionals, particularly nurses. It examines different conflict management styles, such as dominating, obliging, avoiding, compromising, and integrating, and their impact on job satisfaction, stress, and burnout. The review underscores the importance of understanding and applying appropriate conflict resolution strategies in nursing practice. Next, we will discuss effective communication. Communication is the foundation of safe and effective patient care. Let's break down what effective communication looks like in a healthcare system. First is active listening, not just truly engaging with the speaker. This builds trust and ensures that you're capturing a full message. Clarity and conciseness are also critical. Avoiding ambiguous terms or medical jargon, especially when talking to patients or across departments, helps prevent misunderstandings. Closed loop communication is essential during high risk situations like code blues or surgical procedures. When someone gives an order, the receiver repeats it back to confirm it was understood correctly. Next, empathy and respect. These humanize interactions. Patients and colleagues alike respond better when they feel heard and valued. Nonverbal cues like eye contact and tone of voice carry just as much weight as what's being said. Be conscious of these, especially in tense situations. Then there's cultural competence. This is also key. We must be sensitive to how different backgrounds influence communication styles, decision making, and health beliefs. Lastly, structured tools like SBAR, which stands for Situation, Background, Assessment, Recommendation, help standardize communication and reduce the chance of critical details being missed. Mastering these elements doesn't just improve teamwork, it saves lives. In the second reading, Quality Communication, manage conflicts and confrontations in the healthcare setting. This article emphasizes the critical role of effective communication in resolving conflicts among healthcare professionals. It discusses various strategies such as formal negotiation, mediations, and assertiveness techniques, highlighting their effectiveness in fostering a collaborative environment and ensuring quality patient care. Just a few reminders of the week. We do have discussion posts that are due Wednesday, 11:59 p.m. is the latest Eastern Standard Time. The initial post is a minimum of 500 words. Then you must reply to one of your classmates by Sunday, 11:59 p.m. Eastern Standard Time with a minimum word count of 250 words. Also, there is a case study that is due this Sunday by 11:59 p.m. Eastern Standard Time, and that is a total of 2 to 3 pages. Please make for sure that you get on and download or upload your submissions before 11:59 p.m. without penalty. Reflecting on this week's module, what are the most valuable insights you gained about conflict resolution and effective communication in healthcare? Additionally, is there anything I can do differently as your instructor to better support your learning and engagement with this topic? Please be as specific and honest as you're comfortable being. Your feedback is appreciated and will help shape future sessions. I would like to thank you for your participation in this course, especially in this week's assignments. If you need to reach me for anything, you can reach me at the number on your screen or by email at bensleybrooks@vul.edu. Thanks so much for your participation, and I look forward to your ongoing success in the program.